Hey everyone, thanks for joining us today. We're going to hopefully answer any and all questions that you have regarding the COVID-19 virus. Okay, we are joined today with Dr. Yee. He is, without any question of doubt, an expert on everything that we're going to be talking about today.
So I actually practiced in internal medicine for a good part of about 18 years to about 2 decades. I also did about 3 to 4 years of emergency room and urgent care, and then 2 years of dermatology. After that, I was called by a large pharma company, and I was asked to do the main research here in Hawaii, where I've been doing that now for about 20 years. My research has encompassed everywhere from transplant medicine, cardiovascular disease, meaning heart diseases, lung diseases, kidney diseases, dermatological diseases, autoimmune diseases, just about everything, including the central nervous system. So I'm humbled that you folks have asked such tremendous questions. They are very pertinent to this disease. And as we go through this presentation, I will probably have answered about 90% of your questions. However, with that being said, I still have listed all of your questions at the end so that I can go over them again succinctly. This is an animation of the coronavirus. And I wanted to show this for a simple reason. The virus basically has 3 major components. If you see the circular round shaped donut, that is what we call the enveloped capsule. And this is what carries the virus, the disease. Inside this capsule is what we call a single-stranded RNA, which it means is just the genetic material of the virus. And that genetic material is what enters the human host and causes disease. How does it do that? It does it by all of these little spiked proteins that you can see that is attached to the virus. And these little spiked proteins, I will show you later how it works. But basically, that is one of the components. Now, people asked in one of the questions was, Dr. Yee, how small is this? Can we see it? And this doesn't make sense. Well, and I know, Solomon, your hair is a little short, but if you can pull your hair and you look down the end of the hair where you just see the shaft, just in the middle, that little round circle that you see is, let's say, the size or the diameter of your hair. If you look at 3 o'clock, there's a small little tiny dot right next to one of those spiked proteins. That's about the size of the virus if you could see it. That means on the shaft of a little hair, you can put almost 1,000 virions just at the tip, That's why we can't see these viruses. I'm going to now show you what this actually looks like in the next pictures. I'm going to share a little bit more first about the coronavirus. So it's very similar to what we call the SARS-CoV-1. And this was the SARS-CoV-1 that we saw back in 2002, 2003. This is the virus that also came out of China. And it did create a severe acute respiratory syndrome. That is why we call it SARS. Now, it was also caused by a coronavirus that looks like today's virus, the COVID, but not exactly. And I will show you the genetic sequence. When we look at the MERS coronavirus, it also comes from the same family. So it's like Solomon or Mary. If you have a family, you have a brother, you have a sister, you have an aunt, you have an uncle, a husband, and a wife. It is the same thing with the corona family of viruses. Currently, we know that there are 9 viruses, 9 of them that have now zoonotically, they have transferred themselves from an animal to a human. But we know of the 9, only 3 have caused major problems. And these are the 2, SARS-CoV-1, MERS-CoV, and then of course today we know the COVID, which is on the top. Now, the protein capsule that surrounds this again is made out of a lipid, meaning fat, as well as protein. And this is why when we talk about hygiene, this is the area we are going to attack. this area of the phospholipid capsule. Because if I break it open, then the genetic material cannot survive and it dies. And this is why someone had asked questions about hand washing, which was an excellent question. That is why it's important. We also have certain medicines that will attack these little protein spikes that I will also share with you. Okay? As we go to the next slide, this is the actual virus. This is what we call an electron micrograph. Has anyone ever used a microscope? Well, a microscope essentially can see bacteria. And bacteria is so small that I really can't see it on my hands. And I'm going to show you later how we plate for bacteria and how disease is actually everywhere. But probably 99% of the time, God made the body so amazingly well that our own immune systems take care of viruses every day. And this is why with other viruses or other bacteria, we generally don't even complain about them. However, if I go to a place that I've never been exposed to a certain virus or a bacteria, and my body has not made an immune system to protect it, then I can get sicker than other people. We'll go to the next point here. Now, someone had asked, so Dr. Yee, I've heard animals are attributed to this. And which animals? And can we eat the animals? So what this is if you look at the very top on the left-hand corner, I have listed this at this thing called the genome. When you look right here, there are two long lines. The one here on the top line is actually the genetic sequence of the coronavirus. That is the entire sequence of the coronavirus. And it is actually quite long. It is about what we call 30 kilobytes long. Now, I think someone was a computer tech, so they would understand what kilobytes mean. But basically, if we make it so that we can understand, the common cold virus here that you see at the very end, it says 50% and common cold. That common cold virus is only 7 kilobytes long. This coronavirus is 5 times as long, okay? Now, what happened was in China, when they first said that this was the coronavirus, they attributed it to the bat. And we do know this. The SARS, original coronavirus, came from a bat, and then it went to a civet, and then it transferred itself to a human. We know the MERS virus went from a bat to a camel, and then transferred itself to a human, okay? So how did we find this out? Initially, the people from China looked at these little splices. And if you see on the bottom, these little splices are what we call codons. They are the same genetic material, but we are looking at them in pairs, okay? And what they looked at was the base pairs, and they said, we found it. The virus that is directly linked to the animal is the snake, the Chinese crate. But scientists here says, that doesn't make sense. Why? Because very rarely will a warm-blooded animal, like a mammal, will transfer to a cold-blooded animal, like a reptile, alligator or snake or frog, and then that frog would transfer to a human. That is rarely seen. Now, it does not impossible, nothing's impossible in life, but that really doesn't make sense. So what we did in the United States was then we took this genetic sequence and we lined it up from A to Z, and we said, how much of this matches all of the animals? The China study only looked at 8 animals. We looked at 10,000 animals. And after looking at 10,000 animals, I cannot tell you 100% that we are sure, but I can tell you this is how the number looks like. So if you make this genetic sequence, say this is from 1 all the way to 100, the bat matches the coronavirus by 96%. So that means 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, all the way to the number 96 is an exact match for SARS coronavirus 2, which is COVID, okay? The pangolin, does anybody eat pangolin? Pangolin? No. Doesn't taste good? Not sure. All I know is it's supposed to be an anteater. I have never tried pangolin, but the pangolin was 91% match to the coronavirus. And now when we look at the SARS coronavirus 1, which was the first coronavirus that came out of China, there is an 80% match to the COVID-2, okay? The MERS, only a 55% match. So we know that more than likely the transmission from animal to human was more than likely bat, pangolin, and then us. Now, as it mutates, it changes its genetic material. So meaning from 1 to 100, maybe the last 10 numbers, maybe 1 to 95 or 90, and then it goes 4, 5, 3, 2, 1, 0, 0, 1. But in the human, it may still be all 1, 2, 3, 4, 5, 6, 7, 8, all the way to 100. But by the time it gets to us, it finds that exact combination for humans, and it now is able to access humans. And we now know that initially, in the very beginning when I did this talk back in February, the discussion was, can it be spread in the air? And can it be spread on a plane? At the time in February, the answer was no. But in March 17th of 2020, one of our peer-reviewed medical journals called the New England Journal of Medicine actually did the testing and demonstrated that it does float in the air, and it can float up to 3 hours. So this is why when we start talking about prevention, I can then share with you, how do we handle this? Okay? So that's basically how the virus is. It is global, pandemic. And how big? How many nations? How many countries? Approximately 212 countries have now reported on the coronavirus. I don't know how many countries are in this world, but I'm assuming that's quite a lot. This number that you see, a number of people of cases reported at 1.7 million cases, that is actually old. That was yesterday's notes. And so I have to always preface this, that understand that what I present to you today will change markedly in terms of numbers within a day, within a week. So currently that number now is actually closer to 2 million. The numbers of deaths that have occurred worldwide is over 100,000. But here's the good caveat part. People do get better. We know about 80% of the people who get this disease, it is very mild. And for them, when I say mild, I would have to tell you, if I were to ask them personally, they would say, it didn't feel mild, Dr. Yee. It actually felt pretty bad. I felt sore, my body was sore, I had fevers, I had a dry cough, I was tired. But they don't go into a severe respiratory distress where they cannot breathe. And those are the ones that we call severe. Anyone we have to put into the hospital, those are the cases we worry about. And that's about 17% of the time. So those are the ones that we worry. When we look at the mortality ratio globally, worldwide though, that number has been relatively small. So although unfortunately I speak of 100,000 people dying, with 1.8 million, 2 million dying, this percentage is relatively small. And when we compare it to the influenza that occurs every year, just in the United States alone last year, the 2018 data reported, we had almost 30,000 to 40,000 deaths from influenza virus. And this is one that we have a vaccine for. So if you look at this, doesn't sound so bad. But the reason why this is more dangerous than the influenza is because for that small percentage of people who get sick, they get sick very bad. And the problem behind that is when they get very sick, we don't know which ones that are in the 80% that are going to shift to the very bad. That is why this disease makes it harder for us to make a diagnosis. Okay? When we look at those of the United States, we are fully almost 30% of the world. And this has questions. Somebody, some people in the United States say it's because of the fault of our leaders, but I don't think so. I think what it was is simply because world travel as it is, just brings in so many people. And in Hawaii, we welcome tourists. But unfortunately, as you can see, subsequently, the case of person-to-person transmission is not good, okay? The number of deaths in the United States is now numbering 22,000. But here's the good part, is of the total number of cases that we say are closed, meaning it's finished, that's either 22,000 who have passed away to the Lord, 32,000 who have recovered. That's told us now that of these two numbers, 60% of the people have recovered. That's good news for me, because it's telling me that we can get over this, but we have to take the proper prevention, okay? These are the numbers that we see in the US as we break it down, and I've given you the top 5 states. So the worst case scenario has been New York City, and then New Jersey, Massachusetts, Michigan, and California. And here is Hawaii. And you can see the huge difference between 499 and in New York, 189,000. So the question would come up in a person who's a clinician immediately would be, okay, we know that New York has 9 million people, so their numbers should be higher. But why is it so much higher than what we have here? Because it really should only be about maybe 9 or 10 times higher. So if it reached 59,000, well, that kind of makes sense. It's 10 times more than what our 500 is, right? But the reason why these numbers are so much higher is, I don't know if anyone's been to New York, but New York is very congested, very closed in. So all of their buildings carry thousands of people. They travel on the subway where everybody is closely connected to each other. And what this does is it allows the virus to transmit from person to person to person. And it can be transmitted through the air. It can be transmitted through respiratory droplets. So if I should sneeze and the mucus comes out of my mouth, it can travel on that mucus. It can also travel by hand contact. So if I do this, and I shake Solomon's hands or I shake Mary's hands, then she will pick it up from my hand. And if she touches her face or her eyes, she can get the disease, okay? So in the New York City, it makes great, easy understanding why their numbers were so high. Everybody was clustered, brought together, and then because there's an incubation period, disease started to go rampant, okay? When we look at how does the virus attack the human cell, remember we talked about the SARS, and this is the COVID, coronavirus. Here is the RNA material, the genetic material. Around there is the little spiked proteins. And this blue thing, or pink, whatever, I'm colorblind, I'm sorry, is actually the human cell. And that is a lung tissue cell. They all have the exhibition of this thing called ACE2 receptor. ACE2 receptor. That is like a lock and a key. So if I want to get into my house every night, I get my key, I put it in the lock, I twist it, the key, the lock knows that this is the exact fit, and it opens. And when it opens, it sucks the virus into the human cell. Okay? Make sense? Yes? Okay. Now, when you look at this then, from here, this spike protein then attaches to the human cell, it gets sucked in, and then that RNA material, the genetic material of the virus, opens up. Once it opens up, it goes down 2 pathways. One pathway is what we call translation, and what it does is it makes all these little proteins. Those proteins are actually the spiked protein around the cell and the capsule, because the cell has to reproduce itself. And what the virus is going to do is use your own human cell to reproduce itself. So instead of you having a man and a woman make a baby, it's going to be your virus and the human cell that is going to make the babies. Okay? Make sense? I know it doesn't sound like what God wanted, but that's how it works. Okay? So what happens then is this process of making proteins is now set that it has the outer shell of the entire cell made. Now it has to make copies of itself in terms of the virus, the genetic material. And this little long line here that you see, it then goes through a process of what we call, if you look on the right side, it says transcription, meaning it transcribes. Somebody speaks and you write. So if I say, Solomon, take a letter, you say, what do you want me to say? I say, Dear Pastor Glenn. You write, Dear Pastor Glenn. This is exactly what the human host cell is doing. It is transcribing the exact copy of the viral cell. So as the viral cell injects itself into the human cell, it then makes its proteins that it needs to cover itself, and then it makes the genetic material. Then it combines itself in this little vesicle, this complex package that you see called a Golgi complex. And that's a process now we call this transduction. And what that does then is it packages it when it says it's ready to go, and then eventually it then spits the virus out. Now there's one other thing though that happens. As this is doing this, the virus starts to make a poison, a toxin. And that eventually, after it makes about 10,000 to 100,000 copies of this with just one cell, it's eventually going to destroy the human cell. And that's the problem that we get into. Okay? Kind of makes sense? Virus makes a baby inside of the human cell through three processes. It transcribes the virus, it translates the proteins, the packages, and then it goes into a complex that forms the packaging, and then it emits the virus. Scientific term, transduction, entering. Transcription, making the copy of the virus. Translation, making the protein. Translocation, pushing it out. So someone had also said, well, Dr. Yee, I mean, we can't see the virus. We can't feel the virus. I heard if I take this in my body, maybe if I catch it in time and drink hot water or chili peppers, I could destroy this. Now, this is actually a very good point. Why? Well, when Tim first brought this question, he said he's not sure, where they're getting this from. But in the olden days, and even today, many medicines that we produce come from many vegetables. In fact, the most common is fungi, which is mushrooms. And many of these types of mushrooms, they would have protective mechanisms. So we would learn how to make it and purify it and produce the organic compounds. However, in the person who asked the question, which was very good, unfortunately, the data shows that hot water or vegetables or peppers or orange juice does not work. And here's the reason why. It's because by the time you inhale this in your nose, and this is just a cartoon of the human body. Hey, Tim, can they see me scrolling with the cursor like this?
Yes.
Oh, good. Okay. So when you see this as it enters, there are three places it can enter your body. Well, there's actually 5, but those 2 on the bottom, on the south end zone, like down here, are generally covered, so you don't have to worry. So we look at the top ones. Here in the north end zone, we have the eyes, we have the nasal passage, and we have the mouth. So when they started getting this COVID virus, we started swabbing the nose, nasopharynx, the throat. We started looking at their stool, and we looked at their sputum when they would cough. These are the numbers of viruses that is emitted in a person who has the COVID virus. This is a number of 10 followed by 11 zeros. So that would make about 110 million viral copies per milliliter. So maybe what is that? Maybe a 1/4 of a teaspoon? Yeah, very small amount. In that little teaspoon, you are making over 110 million virions. That is why hot water can't kill all this, impossible. Neither can peppers or anything else. And if again, you look in the stool, because we do know it is emitted in the GI tract, it's 10 to the 8. In the throat, 10 to the 8. In the nasopharynx, 10 to the 9. So does this make sense? We also know that as it invades, because remember I talked to you about how small the virus is, that just on the mid portion of a hair shaft, you can put 10,000 virions just on that little thing. Well, it's so easy, it can go all the way down into the lung tract, all the way down into the very small air sacs called the alveolus. And when it hits here, it hits these things called the type 1 and 2 pneumocytes. Don't have to know this more, but essentially look at the numbers. That number is the exact number that comes out the sputum. So by the time you say, I'm getting symptoms, it's already way down in the lung fields. When we go then to the clinical symptoms, this is key for you simply because, again, I don't know how the medical care is. Someone had asked this question, so how do we know? Well, generally we know that most of the times fever is going to be the most predominant symptom. Fever means above 37.8, 37.9 degrees centigrade. Fahrenheit, we basically mean 100.4 degrees Fahrenheit. Anything above that is considered fever. I'm aware though, however, unfortunately, Tim has said that you may not have thermometers. So how do you feel? Well, I can tell you when I'm sick and I have a low-grade fever, I feel warm, I feel sluggish, but I know I don't feel extremely hot. So this is the things you have to be aware of for your family, for your children, for your mothers, your fathers and sisters and brothers. If you can feel that forehead, if you can feel under the arms, armpits, and it really is explosively hot, more than likely this is a fever. If they come in with the same symptoms that initially may start off as body aches and fatigue, it eventually will go down that throat and into the lungs. And when they start saying they're getting more and more difficulty with coughing or breathing, until proven otherwise, it could be flu, possible. But until proven otherwise, it probably could be corona as well. And that's when the time you want to be able to get that person to your doctor, your healthcare provider. The incubation period, someone had asked, well, I've heard that has this long and this long. We know that the incubation period in majority of patients, on average, the incubation period can last anywhere from 4 to 14 days. However, there are some sneaky people, and these sneaky people can sometimes last for 24 days. Now, fortunately, most of them don't go this long, but some can. So that's why we say, minimally, if you feel like you have to incubate yourself and stay home, 14 days is generally the safest period. And if after 14 days, you, your wife, your children, your family does not complain of fever, fatigue, body aches, sore throat, or this cough, then more than likely your family is good to go. Now, if you go outside, can you catch it from someone? Yes. The key is social distance, and we'll explain this in a few minutes. So the clinical course of this COVID came out of a New England Journal of Medicine, and what we were wanting to look at was really, in this case, was how many people really who were sick were able to at least leave the hospital. And that is, it comes down to, if you look at the bottom, 86% of the patients who had severe disease, 86% of them were able to live and get discharged. 14%, maybe not. But of the 14%, we believe that about a third of those don't make it. So that means about 4, 5, 6. So about 6 out of 100, unfortunately, pass away. Then we go to this. Where does it cause its problems? Lung this is where it begins in the lung. But as it gets worse, it eventually goes into the bloodstream and it travels, and it then affects the liver. It affects the kidney. It also affects the heart. So this is what we call multi, meaning many, organs, meaning organs of our body, failure. So it begins to create so many problems that the liver, the heart, and the kidney can fail. So what you don't want to do is try and get this disease, right? Because the whole intention is, if you can stay clear of this, this is what you want to really avoid, okay? When we move to transmission, again, the data says aerosolization. We now know that it actually is in the air. And this is why we know if you wear a mask, it will give protection. Now, it's not 100%, but it is better than nothing. And what we're trying to recommend is, if everybody gives protection, it would be better. We also know this. It unfortunately does stay on surfaces. So Tim had made mention that he has, I think, Tim, do we have Clorox bleach? Or
we have some over there. We're trying to get more.
okay. So cleaning all the high touch areas in your orphanages is critically important. Door handles, light switch, to a certain level, computers, the desks, where the children sit, where they eat, where you sit, where you eat, all of those areas every morning before they come in should be cleaned thoroughly. About 2 to 3 hours later, when, I don't know how it works, Solomon, so please share with me later. If they have to eat lunch and they're going to go outside to eat lunch, you have each of these kids clean all of this area again one more time before they leave, and then you let them have lunch, okay? And the goal is, the more you can keep cleaning these surfaces, the greater the chance of decreasing the virus that will be stuck on here. This is the biggest problem. Asymptomatic means A in Greek, or that could be Latin, yes, Pastor Glenn, but A means without. Symptoms is having symptoms. So A, without, symptoms. We know now that there is a group of patients who get the COVID virus, but they have no symptoms. So they can be your brother, they can be your family member, they could be the pastor. So unfortunately, we don't know who carries this. And again, the data is very different. It's very varied. In this one trial here, only 18% were found to be no symptoms. But it went as high as almost 60%. So when I looked at the data, I think I would want to tell you probably it lies in between. Probably about 25%, 1 in 4 are probably carriers, or they have very minimal symptoms, but they carry the disease. So this is why wherever you go, where you know it's going to be a little more crowded than usual, you want to keep 6 feet of distance, but you still should wear masks. If you have hand sanitizers, you might want to use hand sanitizers. Now, if you don't, you should wash your hands thoroughly before you leave wherever you're going to go to. When you get to that place, if there is a restroom and you can wash your hands with soap and water again, that should be done. This is a petri dish on the left where it says toilet thieves. And this is how it normally looks like, completely clean. These toilet thieves then went to 4 different bathrooms, one in Myanmar, one in Ewa Beach, Hawaii, one in New York, any place, okay? They got a sterile cotton swab, sterile, and they swabbed the seat of the toilet, okay? It looks clean. It doesn't look like there's any products left over. They swab it, and then they plate it on the clean dish. They then put this dish in an incubator. What is the temperature? 96.8, 97 degrees, maybe a little bit higher. It's the same temperature as a human being. And then after 4 to 7 days, they look if there's any growth that came from the toilet. This is all the bacterial growth. And that's what I'm trying to show you, is that unfortunately with the virus, what might look clean, you have to assume is not. And you will have to assume that because it may not be clean, what's the best way to keep us healthy? Clean it. Now, when you clean this, if you have Clorox with bleach, or you have even just soap and water, as long as it's not on a computer, but you want to wash that down with soap and water, or you want to wash it down with Clorox, or you want to wash it down with a little bit of alcohol, and then you want to leave it on there for about 30 seconds. Why? The soap and water actually is an alkali, meaning acid base. You folks have cars, and you have batteries in your cars, and you know that in the car, it has acid, correct? Well, the human body works exactly the same, an acid-base balance. It has to be perfectly balanced, and what happens in the virus, it's the same thing. So if I put soap on a surface, if I put alcohol on a surface, I change the acid-base balance. And remember when I told you about the initial picture of the virus, that it has that protein capsule? This is what the soap and alcohol does to the capsule. Oof. And when it causes it to explode, the virus cannot survive, and the virus cannot infect. That's the big critical thing. It cannot infect you. So that is why cleaning your facility, I want to say every 2 hours if possible, would be very good. But again, I would bow to you and say, what is ever practical is what you have to try and do. So if it's just once in the morning, maybe once in the afternoon, and before you go home, then so be it. And then just make sure your children wash their hands very well before they come in, wash their hands before they eat, wash their hands with soap and water now after every bathroom, and wash their hands before they go home and see their family. And that should help to decrease the risk. Not 100%, but decrease the risk. So we go to prevention finally. The hand washing should be with soap, water, good lather, a minimum of 20 seconds. In the United States, we say sing happy birthday 2 times. But when we say hand washing here, this is a little different. The hand washing should be vigorous, okay? But it should go all the way to the elbow. So just like a surgical nurse, a surgical doctor, I know you guys are looking at me like, yes, Dr. Clarence, this is not going to work. So do the best you can. Lots of water to rinse it. Someone asked a great question about, well, if I wash it with hot water, would that work better than cold? And the answer is no. If it's too hot, you may actually burn the skin. And if you burn the skin and it opens a sore in the skin, that is an access for the virus to get in. And then you're going to be in trouble, because that opening is the same thing as your nose and your mouth and your eyes. So again, you don't want to use hot water. Warm water is fine, but so is cold. But you want to use lots of water. Cold to warm water, Clorox, Lysol wipes, high touch point areas, again, doorknobs, the light switches, the desks that you all use, all of those areas are high touch points, okay? And then we talk about distance. Now, the current distance was a minimum of 6 feet. So you're going to hear a lot of your doctors say, stay away at least 6 feet. It was in the Annals of Internal Medicine and the Journal of American Medical Association. This just came out less than 7 days ago. They did the study of how the aerosol can fly. When it's on the air, it can travel as far as 27 feet. It means this: if you can keep people at least 6 feet away, you do it. If you can keep them 10 feet away, better. But again, when it's in a contained area, this is always difficult. That is why we talk about masks. That is why we talk about these masks. Again, the best mask is probably the N95 or another one called an N99 that it looks like a gas mask. But these don't have enough resources, don't have enough money. So if you have the N95, assuredly, I will tell you, if you know you're going to go in a crowded area, you are going to ride on a bus, or you are going to ride on a train, then during that time, this N95 should become your friend. You have to remember, though, that outer surface, when you are finished breathing, could be contaminated with the virus. So the only way we can really clean these N95 masks in your world is when you're finished, you have to hold the straps and take them off by the strap. Don't touch this, because if you do, well, if you touch it, then make sure you wash your hands thoroughly again, right? But if you don't touch it, then you should lay it out in the sun. The sun, theoretically, the ultraviolet light may kill the virus for about 6 hours. Unfortunately, though, that doesn't happen in humans. Someone had asked a very good question about what happens if the monsoon season should come and it's very hot outside, or it rains, or the weather changes. Will that affect the virus? And the answer is, technically speaking, no. The only way that will affect the virus is if the monsoons are coming. So in those kinds of seasons, when the monsoons come, it's not the rain that will create more disease. It's the fact that you are going to cluster together. So as much as you can, wash hands. Don't drink from the same cup. Don't use the same masks. Try and keep your distance. Keep the areas clean. We do know that if you're out in the country and you are walking for exercise and a person passes, that is a very minimal possibility of risk. But again, better if you're walking in open air and this person is at least 8 feet away or 10 feet away, then the risk of getting this is almost impossible, because way too far. And in the open air, it'll dilute the virus out. In a closed contained area, you have to kind of stay as far apart as you can. Then we go to who is the highest risk. Now, this is more what we see in the United States. It may be different for Myanmar, but I can tell you anybody who is older, and older would be my age category, unfortunately, at 66, 70, 80s, much higher risk. So the grandparents, people who have multiple problems with their lungs, smokers, people with asthma, probably will have a higher risk if they should get the disease. And then people who have other types of internal medicine problems. I don't know what the Myanmar statistics are for diabetes or heart failure or high blood pressure, but these are the three that we have seen in the United States that confers a high risk to our patients. And then finally, when we look at a CT scan, this is how we see the disease. On a normal scan, this is all normal lung tissue. But these areas here, these glass opacities, these consolidated areas, all of these represents the virus invading into the lung tissue. And what it's doing is, over time, when we look at a cross-section of the CAT scan, it first shows what we call ground glass opacity. And what that means is, in that little lung tissue, it first fills with fluid. This is what we call edema. When it fills with this fluid that is in between the air sac and the blood vessel, it goes right in this little sac here. It looks like this. When the infection starts to go into the lung sac, I think if you recall, I showed you a picture of the alveolus, the little sac. Once that infection is inside here, now it's called consolidation. And finally, when it becomes overwhelming and it's in the tissue space, it's in the lung, and it's all around the tissue, it now becomes like this called, I don't know why we use this name, crazy paving pattern. But it tells you basically now this person is going to be in trouble. At this area, we could possibly help. At this area, if it's not too many of them, we could possibly help. Once it gets into this area, we are now getting more dangerous. So your questions. If the person is affected by the virus, he's recovered and totally healthy, can he get the COVID-19 over again for a second time? If the person is tested by his blood or a sample from his nose, and they look for antibodies, meaning the protective mechanism that says, yes, you had COVID-19 and now you have antibody protection, then more than likely, person cannot get reinfected. But if a person just says, I'm Solomon, I've gotten sick, I think it's COVID, I feel better, I can't tell you whether or not it truly was COVID, because it could be influenza, right? So for those kinds of people, this was a very good question. I can't say that for sure unless you have the antibody test, okay? I want to be clear how the virus spreads. Is it by air? I think we answered this, yes? It's in air, yes? Okay. Some people say that this virus stays in the throat for 3 to 4 days before it gets in. Can the virus be killed by a mixture of hot water, salt, and off? The answer, no, correct? Some people say that the virus can be cured by eating hot food such as pepper, ginger, onion, and hot water. I think it just makes your tongue hot, but not the virus, right? When someone gets affected by the coronavirus, what is the first sign? As we said, it can be fever, but it can just be sore throat. It can be tiredness, fatigue, looks almost like the flu. But over time, the majority of patients begins to get more fever and begins to get more cough and shortness of breath. Then you know, okay, more than likely this is could be COVID. Next question, is there any other medicines to take in prevention for COVID? Is the infection related to weather? We answered that, and the answer is probably not, no. Do you really need to wear a mask every time? If you were my wife, the answer is yes. If I don't like you, the answer is yes. Can we use soap and water, washing hands, to prevent the virus? And why is it so important? Because remember, that cell membrane is very sensitive to soap. When that soap hits that membrane, what does it do? It takes the fat and it explodes it. And when it explodes it, the virus is no longer contagious. But you need a lot of water because you need to wash the virus parts off of your hand. And then you should wipe your hands thoroughly with a clean, I would say clean paper towels, hand towels. It was originally reported in the many news media that came from an animal, bat, dogs. We talked about this. The transmission that we seem to believe at this point is bat to the pangolin to the human. But each time that virus changed itself, so by the time it hits the human, the major person you got to worry about is not the bat and not the pangolin, but the human. So that's why you have to worry about someone giving you the disease. How fast can the virus spread? We again talked about this, incubation, 4 to 14 days. And then remember, about 25% are going to be asymptomatic, no symptoms. Those are the dangerous guys. So wear the mask, keep your distance. We heard there's a different lifespan of the virus. Exactly. Steel and plastics, the current study out of New England Journal of Medicine said 3 days, 72 hours. So how do you take that? Wash, 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 right? Soap and water. If you can use antiseptics, use that. Alcohol will work, but don't put pure alcohol on your hands because then it'll crack your skin and then you're going to be more susceptible to infection. But you can definitely use gloves, and if you have alcohol and you'd rather use that, fine. Bleach and water as long as it's diluted, but soap and water by all means is just as good, and in the high touch point areas. Can a single virus cause sickness? One single virion, probably not. Because most of the times though, you are going to inhale, like I showed you on the shaft on the head of the hair, 10,000. And remember when you saw the count, this was 10 to the 11, 110 million virions. I don't think it's possible for my nose, because it's too big, to inhale just one virus. More than likely, at minimum, I would inhale between 10,000 to 100,000 copies at any given time. And so that's why, mask is safer. Now, remember again with the mask, when you inhale, that virus is going to hit this mask. So when you finish at the end of the day, wash this mask thoroughly in soap and water, and then rinse it out, and you leave it out in the sun for about 6 hours. Okay? A whole family community lock down themselves and stay home. No visitor comes in the house. Can the family still catch the virus? Theoretically, if nobody has the virus and your family is clean, theoretically, this is actually the best way. That is probably very smart. Regarding social distancing, we said this. 3 feet is not going to work. 6 feet is minimum. So I actually also say 9 feet is better. Okay? So if you can spread out 9 feet, do it. But at least a minimum of 6 feet. And do we need to practice this at home with family members? The answer is yes. Recommend making our own clothes. Yes, I would recommend you making your masks. Make as many as 2 at least per person. And the reasons behind this, the reason why is the best mask, again, is the N95, a plastic covering protection on your body, a viral clothing on your entire jacket. The cost of that would probably be, in US dollars, maybe about $150 for one or $50 for one. So I don't know what that means in Myanmar, but it could probably be very expensive. So the better way is if you make the mask, we know it reduces your risk. And so as long as you wash the mask, I would say yes. Media around the world exaggerating the virus effect. I think to a certain level, whoever asked this question, you're probably correct, because sometimes news sells more money. So sometimes they like to put more fear than education. I'm a belief that God gave us a brain and gave us science as part of that, of part of God. So it means that what I learn, if I share to you on an educated basis, it now gives you strength. It gives you talent, and it gives you the knowledge and wisdom. Now, what is the difference between knowledge and wisdom? Knowledge means you know 6 feet is good, but you don't do it. You say, 3 feet is better, okay? Wisdom is knowing it's 6 feet and you go to 9. That's the difference, okay? Now, it says, exposing myself out in the sun in the morning can help. It can for the mask, not for you. You're just going to get sunburn. Because remember, when we took the nasal swabs, the number of cells already was innately in your body. It's not going to go away. So don't do that. Documentary video recently faced on Facebook. Okay. I do not understand everything. Okay. I looked this up, P41AP. It was quite interesting because I sat there and I said, there is no component of the genetic portion that I know of the P41AP in Wuhan. And what this actually stood for was page 41 in a journal by the AP News. So P standing for page, I think it stood for 41, the number, and AP News. So unless I'm incorrect, whoever asked this question, I apologize. I don't have an answer for P41AP. You said then, do you think virus can be controlled sooner or later? I think now is the time. Now is the time, and you need to be educated with knowledge, and now you need to use the wisdom of the knowledge and use it properly. And then I think you had about 10 more. I think they were pretty simple. Possible, is there any sign that all of you have COVID? Is it possible that there is no sign at all? Yes. Remember we talked about 1 in 4 could be no symptoms, asymptomatic carrier. Can we say that COVID-19, when we have coughing, pain in the throat? Yes. These are probably the cardinal symptoms of COVID, but it can be influenza. So it is going to be hard unless you take a nasal swab and a test. And this is possibly why Myanmar only has 50 cases, because they may not be testing enough. Without having contraction with a positive patient, can we still be infected from the air? Yes. Can we be infected by touching objects? Yes. I personally tend to feel that COVID-19 occurs in most Christians. From the scientific standpoint, you just saw 212 countries. I'm sure there are many countries that are Muslim states like Iran, Iraq, Afghanistan, Pakistan. Myanmar is Buddhist. That is interesting. They don't have many numbers, But then again, it could be simply that you may not be testing, or that the virus has not traveled in yet.